Hi, everybody. My name is Abby Kirabarajan. I'm a medical student at the University of Toronto. I'm really excited to be sharing this poster with you today. It's on our project on morning discharges and patient length of stay in general internal medicine. Before I begin, I wanted to say a huge thank you to all the co-authors on the project, and especially Dr. Verma, who is the supervisor. Thank you so much. So before we begin, it'd be really useful for us to discuss the reason why we did this study in the first place. So there's been a lot of interest in improving patient flow and reducing hospital length of stay within general internal medicine. However, there are a lot of different ideas that haven't necessarily been evidence-based. One of those ideas is morning discharge, which has been hypothesized to free hospital beds earlier, thus reducing ED wait times for incoming patients and potentially increasing beds for elective surgeries and speeding up the flow of the hospital. However, it's unclear whether efforts to increase the number of morning discharges might have had a negative impact inadvertently on patient length of stay. For example, by incentivizing physicians to keep patients in the hospital for an extra night, for example, to facilitate discharge in the early morning. So we conducted this retrospective cohort study using the Gemini data set. We looked at all GIM patients discharged between April 1st, 2010 and October 31st, 2017. And we looked at ED length of stay as well as hospital length of stay as our primary outcomes. And what we found when we looked at 189,000 approximate patients, we found that 19% of discharges occurred between 8 a.m. and 12 p.m. We found that the number of daily morning discharges and number of total discharges per day was 1.7 and 8.4 respectively, with the median ED length of stay around 14.5 hours. And the median hospital length of stay was 4.6 days. We did a strong multivariable adjustment, and we found that there was no significant association between morning discharge and hospital length of stay, as well as ED length of stay and 30-day readmission rate and in patient in hospital mortality. And we found that there's a general lack of association between morning discharge and length of stay consistently at all 7 hospitals. So at one hospital, there's been of an outlier. So in conclusion, what we found was the number of morning discharges was not significantly associated with shorter ED length of stay or hospital length of stay in GIM. So it's possible that by increasing the number of morning discharges, that alone is unlikely to substantially improve patient flow through GIM. But of course, further research is needed to really determine the effectiveness of specific interventions and what happens next from them. Thank you all, and feel free to reach out to our team if you have any questions.